The synthetic cannabis death toll is rising, but police say they're no closer to discovering the source of this killer drug. A man in his 20s who was being treated at Middlemore Hospital in South Auckland has become the 8th person to die this month. The Drug Foundation says authorities are not doing enough to deal with this public health crisis. And the Associate Minister of Health, Peter Dunn, agrees. Anusha Bradley filed this report.
Synthetic cannabis is 50 times stronger than natural cannabis and can induce seizures, heart and kidney problems, as well as violent and aggressive behaviour. An 8th person died overnight, and the deaths of 7 others in Auckland are being investigated by the coroner, while St John Ambulance says it's dealing with up to 20 cases a day. Acting Detective Inspector Peter Florence from Auckland Police says they still don't know where the drug is coming from and they need the public's help.
It's a big worry to the community that people are putting these toxins in their body. They're taking an illegal drug. It's bad for them, and as we know, it can kill. This is a big concern for us, and we want people to let us know if people are dealing or using in the drug so we can prevent that and give them the correct information about this problem.
Mr Florence says, contrary to some reports, there's no evidence to suggest the drug is being spiked.
We've tested one sample, the tests have come back. There have been other samples sent in there. We're waiting for results in relation to that. What has come back is that it is synthetic cannabinoid or synthetic cannabis, which is a drug in itself, a legal drug, but there is no, hasn't been spiked in any way. There's no other foreign substances in it.
It's no weed killer or fly spray or anything like that?
Not in what we've been tested, no.
ESR, which carries out the tests, says it's identified more than 20 different types of synthetic cannabis over the last 2 years. Its forensic chemistry manager, Kevin Walsh, says one type, called AMB Fubinaca, is 75 times more potent than the THC which is found in cannabis.
We first identified that about 12 months ago. And since then, it's become one of the predominant synthetic cannabinoids that we're detecting through the laboratory. So AMB Fubinaca has gained some notoriety, certainly overseas in the press, and some have referred to it as a zombie drug.
The chief executive of the Drug Foundation, Ross Bell, says the police have known about this dangerous drug for more than a year, but didn't share this crucial information with those at the coalface until recently.
There doesn't seem to be a clear protocol or process in place where that very important information is made more widely available to people like us, drug treatment agencies. So we need something in place when the police discover these kinds of substances, rather than sitting on the information, to have that information made more widely available much more quickly.
The Associate Minister of Health, Peter Dunn, agrees the police need to do more.
I think there's certainly been a problem in getting the information from the police. I was a little surprised, for instance, to get less than a couple of hours' notice of their announcement last Friday. There's been no contact with my office at all on this. We need to be working together on this, and they need to be providing to the health authorities all of the information they've got in advance of making it available publicly so we can actually get on top of this.
And a special incident response unit is being set up at the Auckland District Health Board in conjunction with the police to try and get a handle on what synthetic cannabis products are being used and how it can be stopped before the death toll climbs further. For Checkpoint, Anusha Bradley.